Broadcasting live from Studio One high atop the WVOX tower. This is Westchester's only locally owned and operated community station for you and yours. For more than 50 years. 1460 WVOX.
WVOX.
Welcome to Slow Medicine Radio. Our host is integrative medicine Dr. Michael Finkelstein. Michael offers medical advice from a holistic paradigm, including both medical and metaphysical philosophies from the full spectrum of human experience. Slow Medicine Radio offers fresh ideas on how to attain a state of wellness that seems distant given the limitations of today's medical paradigm. It introduces you to thought leaders who connect the dots between theory and practice, examining health from a broad perspective with regards to medical diagnoses, conventional and alternative therapies, healthcare policy, and related topics that warrant further thought and discussion. Slow Medicine Radio does not prescribe to take this or do that. Instead, it offers an open-minded, intelligent, and practical approach to living, resulting in greater health individually and collectively. Here is Dr. Michael Finkelstein, the founder of Sunraven, the home of slow medicine in Bedford, New York.
Well, welcome to Slow Medicine Radio. I'm your host, Dr. Michael Finkelstein, and it's a beautiful day here in New York, one of the early days of fall, and it feels like it. It's very refreshing. The air obviously is changing, and we have a lot going on in the world as well. Big transitional time as we approach the fall election. Of course, a lot of people tonight are going to be tuning into the presidential debate. We're here every Monday at 5 o'clock, 1460 a.m. and WVOX.com. And the idea of the show is to talk about health. And when we connect the dot between tonight's main topic and news, which is the presidential debate, and health, what I want to talk with you about today is fear, specifically about the medical effects of fear. And speaking presidentially, there was a famous president, Franklin Delano Roosevelt, who said the only thing we have to fear is fear itself. And I wanted to explore that from a medical perspective, because that's not just a simple statement for political effect, but when we are in a state of fear, it has fairly profound effects within our bodies and in our whole lives, as a matter of fact. So that's what I want to talk to you about, and I want to invite you to call me as well, 914-636-0110, to express your thoughts and views on that subject and anything else that might come up that seems right to you. I'm here for the next half an hour or so, and my interest is to help you in any way I can. So let's talk about fear. What happens when we are afraid? Obviously, is the thought that I'm afraid. You may sort of have a sense of some doom or gloom. But that sense of doom and gloom, just by the way, is not just something you're aware consciously. That actually is something stirring in your body as a result of a thought, conscious or unconscious, that gets you to feel threatened. And when the mind is threatened, the adrenal gland produces adrenaline. You go into what's called the fight or flight response. The sympathetic nervous system, the part of our nervous system that gets us to move away from noxious stimuli and to be able to more swiftly run from something like a charging animal, gets put into place. This is a very natural, instinctual phenomena. It happens to most animals, and it's good for us when we really need to run from a lion. But when it's turned on in response to something that I'll say is more imaginary, and I don't mean our thoughts and concerns about our future is just strictly imaginary. They may become real and they may be something very important, but it's not an immediate threat. Our body doesn't necessarily know the difference. It still responds with the sympathetic nervous system's fight or flight. And that's okay a little bit, but when it's turned on in such a manner that it's nearly locked on, people get into states of exhaustion. We could call it adrenal burnout. There's just the flood of these neurochemicals, these hormones, neurotransmitters, that eventually deplete our body because it's getting our body fired up, ready to go, ready to run. And it's meant to work for a few minutes, not chronically on all the time. The inflammatory response that results can, in fact, injure us. There are other processes in our body, like diseases, infections, that may normally be, a problem for us to deal with. And when we're on top of that, additionally inflamed, we don't deal with those things very well. So there is real effect in our bodies with regard to fear. Now, I want to sort of step back a little bit and just report the good news, which is that the parasympathetic nervous system, the complementary system that's co-designed in us, is there to turn off the sympathetic fight or flight. But we need to necessarily intentionally do that, especially in the chronic state, which becomes something beneath our awareness. So we need once in a while to pause, take a deep breath, and to turn back off the sympathetic nervous system by turning on the parasympathetic nervous system. And the prototypical way of doing that, I mentioned the adrenal glands is the core organ of the sympathetic. It's the diaphragms, the big muscle beneath our lungs that separates our chest cavity from our abdominal cavity. That's got a large nerve called the vagus nerve that spreads out over the domes of the diaphragm. And that nerve goes all the way up through the center of our chest, up in through our neck, up to our brainstem. And when we take a deep breath and that diaphragm descends into our abdomen, the nerve endings of the vagus nerve are stimulated and our heart rate slows down, our blood pressure comes down, blood is redirected away from the muscles of flight to the other parts of our body, like our digestive tract, our liver, our kidneys, our brain, so that we restore normal homeostasis and function. That's sort of what you want. That's the essence, by the way, of slow medicine. Again, I want to invite you to call me, 914-636-0110, because this is a topic that really will be important to all people, whether you're living your life not at the current moment concerned about a condition like a disease or an ailment. But I want everyone to be aware that fear, which is ubiquitous these days, especially when we look at the news media and when we think about the results of the November election, one way or the other, most people are concerned about an outcome that's not their desire, that we have this ongoing and that we need, or it's valuable for us to learn how to handle fear by not necessarily preventing it altogether, because how can we really do that? But we can neutralize our response or in some way intervene before it gets carried away. Over the last week, I've actually spent time in California speaking to a number of groups, including a medical group at Grand Rounds at El Camino Hospital in Mountain View, California, and then speaking to some community groups. The community groups, primarily those affected with cancer. And I raise this point, which is that being afraid of a disease like cancer exacerbates the condition. Again, it's understandable why you might be afraid or why you concerned about the future, but the fear response itself exacerbates the condition. And so it is so important if people can learn a way to deal with fear. And I shared with them over the course of the couple of days that I was there different ideas and modalities, as well as simple techniques like deep breathing that can be very useful. But there is this other challenge that people have when something is chronic, when it's really there, when it won't go away, when they have a disease like cancer, or let's say you have heart disease or an autoimmune condition or chronic stomach problems or headaches or pain syndromes. These are all chronic conditions that people not only are aggravated about, but they may be afraid to some extent because they're worried that they'll continue, they won't get better, or it'll get worse. Even, speaking to most people, even knowing myself, the concern about the end of life, dying, death, these are things not everyone fears per se, but there's a little anxiety, and anxiety is the sister to fear, especially when we think about the physiological response as I described. So these are important subjects. They happen to everybody at all times, and again, how nice would it be to be able to control your body's response and your mental, emotional, thought process response, which is part of that, so that when something does cross our radar, something that might concern us, we don't immediately jump into this fight or flight response and stay there. Again, call me, 914-636-0110. Perhaps you have a question or thought on this subject, or maybe even just an example of how fear strikes you, maybe what you're dealing with, and then we can talk about maybe what you can do. So one of the things that I want to present right now is what you can do is consider the following sentence. Let's say you have a disease, right? So let's say the disease is cancer, as I gave in talked to that group just last week, and it would be common for somebody to share with a friend, I have cancer. And I want to pull that phrase apart. I have cancer. So you could substitute whatever you may have, let's say, for your personal reflection on this as you're listening to me right now. So let's say you have heart disease. Let's say you have an autoimmune syndrome or stomach problems or headaches or chronic pain. Or let's say you're just suffering from a mental, emotional condition, sensitivity, depression. So you might say, I have this, I have that. Let's break that down. So the word I in that sentence is what I want you to reflect on. So who's listening to me now is sort of how I would follow that up. So in other words, you're there in your car at home listening on the radio or on the internet, and I want you to consider for a second, who is actually listening? Is it your ear that's listening? No. Your ear is a vehicle, somehow transmits sound into your brain. Gets into your brain, touches neurons. Okay, so the neurons are getting something of a message. But who is actually aware of sound, aware of the words, understands the English language, to be able to then think about what they just heard? That is what I would call your consciousness. Your conscious awareness is the you, is the I. That conscious awareness does not have the disease. Conscious awareness is aware of a body that's related to it that has a condition that we might call a disease. And that's really important, because if you can just use this a little bit, realize there is a natural separation between your body and what it has, even if it's life-threatening, very difficult, really important. But the I, the conscious awareness, is not the same. You're not defined by that disease. In fact, consciousness, a lot of people talk about, may actually transcend the body, may actually transcend the issues of mortality and limits. And I think that that's useful. It's not required that you have deep religious or spiritual belief. It's just something I want you to think about. Who's listening? And realize that the who that's listening is not your body. And so your body might have something that it's dealing with. It might have something that it could acquire in the future that the I who's listening may be worried for the body. But no need necessarily to worry for itself, because that consciousness is a non-physical phenomena. Let me pause here. We'll take a break. I want you to think about that. It may be challenging as a thought, as a concept, may even appear abstract, but I want to pursue that with you and tease it out a little bit and see what effect it might have and what potential for you in terms of just calming down and healing maybe an ailment that you have, and certainly allowing you maybe to respond to fear and anxiety about mortal threat and other things a little differently, so that you stay a little bit more calm. And that in turn actually will be good for your body. So let's talk about that when we come back. Write down this number, 914-636-0110, and call if you have a question. Otherwise, we'll be back in a minute.
You're listening to Slow Medicine Radio. You can find out more about the show and the work of Dr. Michael Finkelstein by visiting his website, slowmedicinedoctor.com. Slow Medicine Radio is sponsored by the Slow Medicine Foundation, dedicated to providing community-centered experiential and reflective learning for individuals, families, and groups, offering educational programs, events, and resources, as well as insightful health evaluations with customized medical guidance. Dr. Finkelstein works with his wife, Robin Queen Finkelstein, at their farm, Sunraven, in Bedford, New York. And they invite you to visit and take advantage of this unique resource, including men's and women's groups and couples programs. If you think about it, much of what we experience when we don't feel well is a result of the fast world and how it affects us. Therefore, if fast is the disease, then slow is the medicine. Visit Sunraven, the home of slow medicine in Bedford, New York. Go to slowmedicinedoctor.com or call 914-218-3113. And thank you for tuning in Mondays at 5 p.m. right here on 1460 WVOX.
Well, welcome back to Slow Medicine. I'm your host, Dr. Michael Finkelstein, and you're listening to WVOX 1460 AM on your dial and worldwide at WVOX.com. And this show is about your health, about ideas that go beyond maybe the conventional Western medicine and into other areas where you perhaps can really help yourself beyond what even doctors could do for you. I often use the analogy like seeds and soil. You know, a doctor might give you a prescription, call that a seed. The prescription might be really good. It might help you deal with an ailment, let's say an infection or a chronic condition. But you're going to put that seed, the medicine, into soil. Soil is, you're going to first digest it, of course, and it's going to get through your body and your blood, and it's going to go into all your cells, and it's going to have an effect. Of course, we also know that there are side effect potentials. So when this seed gets into you, it's going to have either 100% positive effects or something less than that, including some negative effects. And what's the difference? Why do some people do really well with the medicine for a particular ailment and other people don't? And that's when I would say, look at the soil. Everything else that constitutes that particular individual. And that's a lot of things. It's, of course, the rest of the body and how that body is functioning metabolically, and it's how the mind affects the body, meaning if that person is anxious or in fear, circulating a lot of inflammatory molecules as a result, as I just described, then that soil is not necessarily as well balanced as another soil. And then we can even look beyond the physical and the emotional into the life's purpose of that person. Is this person flowing in harmony? Is this person able to accept uncertainty? Is this person living their life's purpose and passion and feeling strong from a spiritual, nourished perspective? Well, that's what you could work on. You could work on your body the way a gardener would work on his or her soil. You can work on the mental, emotional processes so that you stay calm and tranquil, because that improves things. And you could keep trying to plug into why are you dealing with any of this, and take, again, maybe a more abstract, metaphysical, even esoteric point of view, just to try it on, not necessarily to always believe every detail of it, and there's a lot of uncertainty, of course, but when you have a faith in something beyond yourself, that this all will actually make sense, it actually is soothing and calming to the rest. So that's why it's, I think, important. It's not a requirement, but it is important if you could embrace some of them. So getting back to fear, if we don't know why we're here, if we don't know why we're dealing with what we're dealing with, if we're upset and reactive to things that happen that are beyond our control, then we actually inadvertently don't manage the fear response as well as we could. And we allow things to happen the way they will when, in fact, we have a lot of control. We actually have a lot of control. So I've done this before, but I think this is a good time. So let's say this whole discussion is aggravating to you. You're used to the world a certain way. Physical body is a physical thing. Sometimes your emotions get the best of you. You can get queasy or nauseated or a headache, but you don't really pay too much attention to the connection between your mind and your body. So this is sort of suggesting that maybe you have more control and you don't maybe feel so motivated to take more control because you already do enough work in life. So I want you're the perfect candidate then, when you have that type of doubt, maybe even a little skepticism, to pause. Let's see if I can help you. So let's do a little breathing exercise right in the moment. Don't do it if you're driving, but you could pull over or you could do it a little bit, but I'm not going to ask you to close your eyes, but get into a comfortable position. For the moment, try to focus carefully on what I'm saying, meaning filter out other thoughts for the moment. Listen to my voice. And see if you can get carried away for the moment in your mind's eye, using your imagination into a place, not where you are right at the moment, but that's your favorite place in the world. Maybe it's the beach. Maybe it's the mountains. Maybe it's by a river or a lake. Maybe it's with your grandchild or your dog. and you're sitting there in a comfortable place. Temperature is perfect. The air is flowing just enough. You may hear sounds and smell fragrances that really make you feel warm and home. Imagine you're there, and you're so relaxed that your body just sort of effortlessly dissolves into whatever you're sitting on. In fact, you, in your mind's eye, just may be held like on the best recliner you can imagine, warm, soft, embraced. Now take a deep breath, remembering that if you take a breath a little deeper than usual, where you actually push your diaphragms down so that your belly expands, forgetting what you might look like. You know, you puff up your belly a little bit, but you take that deep breath and you stretch the diaphragm down. Now in your awareness, based on what I told you before, the little nerve endings of this vagus nerve delight in that sensation. And they send up to your brain this warm energy that slows your breathing down just a little bit more and relaxes your body a little bit more. Your blood pressure calms down. You let it out just effortlessly. You take another deep breath in. Push the diaphragms down. Stimulate those nerve endings. Feel the warm embrace of the chair and the air. You know you're in a beautiful, serene space. And you let it out again. Do that a couple of more times. Each time you exhale, you release yourself further and further into whatever is holding you. You feel incredibly supported. Maybe in the background there's the most beautiful melody playing. And you drift away. You almost can fall asleep. Keep taking deep breaths. Let it out. Now let's come back to the room, to the car. Go back to your business, but just think now, do you feel differently in this 1 minute? Do you feel a little different than you did before? Do you have a sense of calm? Are you softer? Did the previous set of thoughts get suspended? You may even have to reach to try to figure out what you were just thinking about a minute and a half ago. You may have even forgotten what I said, that you were listening to me. You got into your body, and in your body into that well-balanced, regulated state. At the same time that you had those feelings, so did every cell of your body. Every cell of your body went from being rush, rush, rush stimulated to calm, functioning, energized. In 1.5 minutes, you can go from being tense, even afraid, to more neutral. That's a good response to anything that tends to provoke a startle or anxiety. That's a good thing to do before you watch the debates tonight, or in the middle of the debate when somebody does something or says something that stimulates you, and you can see if it makes a difference. Now, it's going to be challenging. Life is challenging. These things keep coming up, and they keep pushing on us. But the more you master something of this sort, and there are definitely other techniques that I will talk to you about over time, there will be a great difference in terms of what your body does in response to things that provoke fear. Eventually, you can get strong, just like I do when I practice karate. It's not that I actually expect I'm ever going to need to defend myself or throw a counterpunch. But by virtue of that practice and that skill, I know that when I walk the streets, I'm much more relaxed. I live in less fear. And in less fear, I'm less tight. And when I'm less tight, I actually, when called upon, can react and can do that more swiftly and more accurately. This is the level of training that I think is good for all of us to do. And it's, generally speaking, so simple, not much more than practice working with the breath. And that's what I call slow medicine. The medicine we need, in fact, for this fast world is slow medicine. And so you can join me every Monday at this time at 5 o'clock. We also work at a small farm in Bedford, New York, where you are invited to come and spend time with us, enjoying the environment, which in part supports this work. The next big event at Sunraven will be a October Fall Festival on October 22nd. And we will have music, great food. Our honey from our bees will be harvested. We'll have some pumpkin decorating, and you get to meet us and talk to us and just experience slow medicine for real. And I'll be this week on Friday, September 30th in Chappaqua at the Senior Center at 1:30. For any of you who might want to come visit there, you can contact the Chappaqua Senior Center and get more information about that. At any time, I invite you to send me a note, michael@slowmedicinedoctor.com, and call us and speak to us and share your thoughts. And so for the next week, I hope that you have a great experience with this practice, and that when things come up that might provoke a little fear, that you now know you have techniques, simple and available, that you can use. And that as a result, you'll be well on your way to a healthier you. So with that, I send you my blessings, and I'll look forward to speaking to you next week. Take care. Peace to all.